could you share with us a bit of how your experience has been being back at working in the hospital during working with young people and who are in treatment, and there's been a lot of stuff coming up in conversation about returning back and going out and being in public and being in hospitals, and just what your experience has been with patients and families and how that's been with COVID, really.
So hospitals have changed to try and make them more COVID secure. Like you would have heard about this in all workplaces. So all doctors, all medical staff had to wear masks. In fact, I was wearing mine just before, I took it off because of the TC, but we all have to wear masks. And in our hospital, for example, in outpatients, the outpatients, including the children, have to wear masks. Everybody gets rung up before they come up to hospital to check have they got any symptoms of COVID. So if you're coming to outpatients, you will be asked that, including the parents. Anybody coming for an overnight stay or going for a general anaesthetic, so if you're having a procedure like a bone marrow test, you have to have a COVID test. Those are national recommendations. And often what that means is that if you're coming for, say, a procedure, you have to have the COVID test done in advance of that procedure done. So you might have to come either to your local hospital or shared care unit and have that test done. And those results have to be ready before you have your general anaesthetic. If you're coming as an inpatient, then they'll do it in hospital. And then generally if patients or parents go into communal areas, they'll have to wear masks. And there'll be the things for the doctors and nurses to do in terms of sort of social distancing that we have to do within the hospital. So our hospital, we have arrows everywhere. We have numbers on our meeting rooms, limiting the number of people who can go into that. And a lot of appointments now are done on Zoom and telephone. Well, that's as outpatients, whether it's a good thing or not, I don't know. And many of you probably have noticed that with your GP. You probably don't see your GP anymore. Probably it's all done over the phone or on video conference. A lot of hospital appointments are also now like that as well, which is a real shame, I think. But that's the reality of it. So it has changed considerably to make the hospitals a lot safer.